Hello, this is Sister Pelma from Bio-Vigour Clinic. Guys, I am a professional nurse. I studied at the University of Pretoria. I've been a nurse for so many years so far, over 10 years experience. I've been working with reproductive health. I've worked with government facilities. I've worked with private sectors. This time around, today I want to teach you about reproductive health. We're not going to go deep to it, but for those who do not have enough knowledge regarding this, today we are within. Look at this. So guys, today I'm going to talk about contraceptives and HPV, human papillomavirus, some of the STIs. But let's focus on this for now, guys. So these are the contraceptives methods that we have. What is a contraceptive? A contraceptive, it's actually a method that we use to prevent pregnancy. How do we prevent pregnancy? Or maybe you want to know what pregnancy is. Everybody knows, I assume, what pregnancy is. Okay, anyway, so this is IUD. As you can see, most people, they don't know about IUD. This is one of the very effective method of contraceptives. So with IUD, we're talking about intrauterine device. So with intrauterine device, we put it inside the womb, and this is done by a professional nurse or either a gynecologist or a doctor. So with this IUD, some of them, they are hormonal, some of them, they are non-hormonal. So we have the ones for 5 years and the ones for 10 years. So we put it inside the womb so that it prevents pregnancy. You know, so here it's so nice because there's no weight gain. You cannot tell us about heavy menstruational period and a lot of things. It's very effective, guys. Then we go to implant on. It's one of the effective methods as well. We put it under the skin for 3 years on the arm, and it's also good for preventing as well. You don't have to come to the clinic more often if you're not a fan for clinics, but we believe that at Bio-Vigour, we should be your fan, guys. You can come every day here. Then we have a hormonal ring. So with the hormonal ring, it's also we do a prescription for you. So here at Bio-Vigour Clinic, we have virtual consultation. So you can even consult with our doctor online, and then we do the prescription for you. And local choice pharmacy will deliver the hormonal ring at your home, guys. So with the hormonal ring, you just put it inside the vagina, and it stays there for about 30 days. And then we can actually do the renewal of script, or we give you script for 3 to 6 months. We have oral contraceptives. This was we can say that they're even less effective, as you can see. So with oral contraceptives, these ones here, most of the times people forget, you know. People forget, so you always have to set them your alarm and make sure that you remember. So those who are not interested on that, you can be interested in this, you know. So they are also effective as well. Then we have contraceptive injections. Some we have a depot, we have Nastrate in those, and then we have the 2 months injection and the 3 months injection. Depot Provera and Nastrate, so you can actually use those contraceptives as well. And then for more explanation in detail, you're more than welcome to come and have a consultation with us. Then again, we have the least effective. You know, we're talking about diaphragm. This one we're talking about what do we call this? Spermicides. You know, to kill sperms. And then we have condoms as well. So with condoms, one I said I will teach you about how to use a condom. If you can check our previous videos. So with condoms, we can have a condom burst. We can have all the, but it is effective because it prevents STIs. It prevents HIV as well. So also, it's one of the options. Very good option. But you must also know how to wear a condom, guys. The reason it's not on the very effective, it's on the least effective because of how people put up condoms. But it's a topic for our next channel. Then we have pulling out. Those who have this, some they pull out, withdrawal, and then some they use their ovulations to calculate, tracking your cycle and all that. So these are the contraceptives that we do have here. And then I just want to touch a bit on HPV for those who do not use this one, condoms. Actually, from all of these, my favorite is this one, condoms. But it's good to do a dual protection, guys. You can use any and still use your condoms. So okay, I want to talk about HPV. This is a human papillomavirus. So if you don't use this condoms, you are going to get HPV. So this HPV is actually part of STDs as well, sexually transmitted disease. So at Bio-Vigour Clinic, you are more than welcome to check for HPV. So as you can see, this is from Ampath Laboratory. So with this, we only test for those who are above 25 years of age and those who even vaccinated for HPV. So also on our next channel, always subscribe. I will talk about vaccination for HPV, which we call it Gardasil, but we'll go deeper on that on the next our YouTube channel. Okay, fine. And then also with these, those who have genital symptoms, bleeding, they can't do the HPV check. And those who have done hysterectomy, they have removed the womb, there's no need to do this HPV anymore. But we are more than welcome to come and do the human papilloma virus test, because this can also lead to cancer. You don't want to have cancerous cells. Meanwhile, we can just like diagnose it now, and then we see how possible treatment that we can actually do. And also, these are the symptoms for STI, guys. If you have vaginal discharge, which is foul smelling, please more than welcome to the clinic so that we can actually treat that foul smelling discharge. If you have abdominal cramps, you have genital warts, sort of like wounds like, and then please, you are more than welcome to the clinic. Report them, don't stay with them at home. And it's also good to do HIV tests regularly. So that's it for the day today. So you know that we are Bio-Vigour Clinic here in Midrand. You are more than welcome to do all tests, laboratory tests, and everything here. Sure.